anatomical terminology, I give the example of carpal, maybe oral, otic, things like that. Again, you do have to memorize all of the terms on this diagram. You should know, if I was to ask calf, what the anatomical term for calf is, and that's sural. Generally, I will have at least 5 or so questions on this on your first lab quiz coming up. So please study this. You will have a chance also to practice these terms with the torso models. There's torsos throughout the room. I also tried to put a mini torso on some of your lab benches. So you can practice those terms with the torso. If I point to the forehead, using the torso model and ask for the correct anatomical term, then you would tell me
frontal.
Frontal. Good. If I point to the chin on the torso model and ask for the correct anatomical term, you would tell me mental. And as I said, all of these terms will correspond to something later on. When we look at the bones, the skeletal system, and we look at the mandible, the lower jawbone, you'll notice that there is a hole in the lower jawbone, and that's called the mental foramen. So mental meaning chin, the area of the lower jaw. Also notice in this diagram the way the woman is standing, the way she's positioned. She's positioned like this. It's really not the common way for people to stand. When people are standing around, they're usually like this, with their hands by their side. But this position is what we consider proper anatomical position. If we were describing relationship between one part of the body and the other, it would be in proper anatomical position, standing like this, comparing the phalanges to the pectoral area, proper anatomical position. Notice in proper anatomical position, my head is straight, my eyes are facing forward, my feet are facing forward, and my palms are facing forward. This is considered the front, the anterior of your hand, not this. That's actually the back of your hand, the dorsal of your hand. So this is the front. This is the anterior view. If I turn around, right, this is the posterior view. Okay. So you should know if the subject is standing in proper anatomical position. Am I in proper anatomical position? No. Am I in proper anatomical? No, right? Okay. It always has to be like this. Okay. Always like this. Okay. We looked at the directional terms last time. Now notice the positioning of the hand. Now it will make sense to you. See the hand? Proper anatomical position, even though you can't see their head, cut off, or their feet, but basically, yes, this is proper anatomical position. I had some questions about the distal term and the proximal term, and I just want to emphasize that when we're looking at distal and proximal, it's typically of the appendages. It's of the arms and the legs. So I might ask you phalanges, carpal, brachial, things like that in terms of distal and proximal. I wouldn't ask you stomach and heart in terms of distal and proximal. Down the midline of the body, that's when you would be thinking of superior and inferior, higher or lower. And then of course, anterior and posterior I can ask too. Facial is anterior, right? Yes?
Yes.
Yes. Okay. Gluteal is posterior, right? Yeah?
Do we need to be superficial?
Yes, you should. Yes. So especially when we're going to be doing the dissections, you'll have to go through the superficial layers of the rat. You'll need to cut through what we would call the skin, right, and the muscle of the rat in order to get deep into the abdominal cavity and look at the liver and the stomach and the intestines. So superficial is closer to the outside of the body. Your skin would be superficial. Your organs, excluding your skin, would be deep to that. So I could say the skin is what to the bone? And you fill in the blank. The skin is what to bone? Superficial. Skin is superficial to bone. Or I could say bone is deep to the skin. Superficial on the surface, deep you're going below the surface. Digging a hole. I also asked last time that you start to memorize the positioning of all of the organs in the body. So that if I was to say stomach, you would know where the stomach is. Is the stomach over here? No. Is the stomach over here? Yeah. Left side of the body. If I said appendix, what side? Most people, this is common knowledge for. The appendix is on the right side. Lower right quadrant. Lower right quadrant. We didn't get to quadrants yet. How about the heart? Where's the heart located? Every time I say heart, I immediately do this, right? So in the chest area, in the middle of the chest area. If I was to put the pointer down here and say, is this the heart? No. No. Even though my heart's very big, it's not that big. Okay. So you should know the locations of the organs, specifically the ones that are listed here, but also some of them you can't see on this diagram. You can't see here the kidneys. Where's the kidneys? In the back. Have you ever had a kidney stone pain? It hurts in your back. Lumbar region in your back. Put your hands back here. It's pretty much where your kidneys are located. And you won't be able to do the dissection and view the kidneys unless you remove these superficial organs to get deep to the kidneys. Make sense? Mm-hmm. Yes. All right. We have talked about planes last time. Were there any questions on planes? What's this plane called? Frontal plane or a coronal plane? And if I use this plane to cut the body, what halves am I getting? What am I separating the body into?
Anterior and posterior.
Good, an anterior and a posterior. If I cut the body here in the middle?
Mid-sagittal.
Mid-sagittal, and what am I getting? Right side and a left side, right? Even division of the body, and even right and left. It's pretty much a mirror image. How about here, if I cut the body transverse plane, or if I cut the body up here, still transverse, still called transverse. How about over here?
Parasagittal.
Parasagittal. And what about at an angle? Oblique. Oblique at an angle. You'll be practicing those planes when we do the dissection on Tuesday. We will do a rat dissection on Tuesday, and you'll get a chance to practice the planes, even the directional terms, but also the regions and the quadrants that we're going to talk about now. Bless you. I do have pigs in the refrigerator as well. So if you wanted to dissect a pig or a rat, you basically have that option. Just let me know. You will primarily be working with pigs throughout the course. Okay. Some of them are small like this, and some of them are quite large. The rats are basically all the same size, about this big. They're a little bit easier just because of their size, but some students like the pigs better because the organs are bigger. Maybe more easy to identify. So I might take out a few of each and have you decide. We will be looking both at male and female and comparing what you see. Another structure that really wasn't visible on the previous slide was the ovaries and the testes. You will be able to see those in the dissection. Okay, let's look at body cavities. We can divide the body not only into anatomical terms or regions, but we can also divide it into body cavities. These are areas that contain organs or structures within the body. The major body cavities are the dorsal body cavity. Dorsal means good. And the ventral body cavity. Think of front or anterior. And ventral. Sometimes, ventral, I think of a vent, like ventilation, and ventilation breathing, lungs, front of the body, if that helps. So dorsal body cavity is towards the back of the body, and the dorsal body cavity includes major organs in the back, the brain and the spinal cord. And we can divide the dorsal body cavity into two subdivisions. The cranial, which you can see that's highlighted here in yellow, cranial body cavity. What's in the cranial body cavity? Brain. Cranium, right? Good. And the spinal or vertebral body cavity, that includes the spinal cord, the vertebral column. Yellow colored area here, that's all on the back of the body. It's all posterior. So it's the dorsal body cavity. Cranial for skull, brain, vertebral for vertebral column, spinal cord, all the way down the back. This yellow area that's highlighted is what we consider dorsal. Notice the kidneys that we were talking about that you could see if you were to remove all the other organs in front of them that were deep, are also posterior, but they're not considered to be in a dorsal body cavity. Everyone with me? Okay. Ventral is this part. Most of the organs are in the ventral body cavity. All that you see right here is all the ventral body cavity. Ventral meaning anterior or front. And we can divide that into two major parts. We've got the thoracic body cavity. Think of the thorax. Your lungs are inside of the thoracic body cavity. Your heart, for example, is inside of that thoracic body cavity. And then below that is the abdominopelvic body cavity. Abdominal and pelvic, two parts to that one. Abdominal organs, liver, stomach, intestines, and then pelvic. They've highlighted that down here below this dashed line. Right, your bladder would be down here, the major organ that we'll be looking at for the pelvic body cavity. Some of the reproductive organs are down in the pelvic body cavity. So where would the kidneys fall? Those are abdominal. They're considered the abdominal body cavity. The thoracic body cavity, including the lungs and the heart, thymus and the trachea, some of these terms I don't know yet, the esophagus. The thoracic body cavity we can look at even further and look just in the center of that thoracic body cavity. We call that the mediastinum. Mediastinum. I'll show you that on this figure here. So what plane has the body been cut in to see the mediastinum? Been cut in the transverse plane. And you should be able to recognize, even though they're telling it to you, that this side is the posterior of the body, back of the body, and at the very top, that's the anterior. So they've cut like this, they've taken that section, and they put it up this way. Still with me? Mm-hmm. Because they could have cut and put it that way, right? Then it would be flipped. What are some organs or structures that you can look for to tell if you see the posterior of the body, specifically the dorsal body cavity?
Spinal cord.
Spinal cord or the vertebra hurt, right? And you can see the spinal cord here and the vertebra, one of the bones of your vertebral column. So you know that that is posterior. You know that's dorsal body cavity, that's the back. Whereas up here in the front, you can see a little snippet of the sternum. That's this bone here, the breastbone. Okay. You can see a little snippet of that sternum, and you see a good section of the heart. So that's all a transverse section through the thoracic body cavity, with the exception of this part right here, which is what body cavity?
Doors.
Dorsal, and be more specific? Vertebral. Vertebral. Okay. So most everything here is all in the thoracic body cavity. But just that center area that the dashed line is around, just this area here, that's all the mediastinum. Just the very center of the thoracic body cavity. Major organ in the mediastinum is the heart. There's other organs here as well, and you can see a section of some of them. This tube is the esophagus. The esophagus brings food from your mouth into your stomach. And part of it runs through the mediastinum. It is located in the thoracic body cavity. Part of it's in the mediastinum. Just to get a better view of the esophagus. Here's a model of the thoracic body cavity and the heart in the mediastinum right here. This is the thymus that I'm taking off. This is the heart that I'm taking off. Can everyone see this tube with the yellow lines on it? Yellow is nervous tissue, by the way. But this tube, this muscle, is the esophagus. So you can see the part of it right here that's in the mediastinum. Everybody with me? Does this make sense? Yes? Okay. So if you were to look at the vessel that is right here, right next to the esophagus, this is a large blood vessel. Largest artery in the body. You don't even have to get so specific, but that's good. This is the aorta. Okay, this is a region of the aorta. And that's what they're highlighting here. That's what this red structure is. It's one of the large arteries that brings oxygenated blood out of the heart, away from the heart. So part of that aorta is also in the mediastinum. Are the lungs in the mediastinum?
No.
No. Are the lungs in the thoracic body cavity?
Yes.
Yes. So you can have an organ that's in the thoracic body cavity, but not in the mediastinum. Still with me? Can you have an organ that's in the mediastinum and not in the thoracic body cavity? No. The mediastinum is the middle of the thoracic body cavity. So right lung, if I was to ask you the body cavity, you would tell me, hopefully, thoracic. Yes? If I ask you the body cavity of the heart, you could give me two answers. Right? You could tell me that it's in the thoracic body cavity, because it is. But more specifically, it's in the mediastinum. It's in that center area. I would ask that you try to be as specific as possible when you answer a question. And most likely, I would not have both terms. If it was a multiple choice question, I would not have both terms there. So if you saw mediastinum, that would be correct. If mediastinum wasn't there, and you saw thoracic body cavity, that would be correct. Oh, okay, good. Yeah, so we'll talk more about the serous memories in one second. That's good. Questions on the thoracic compared to the mediastinum? Okay. So now you can see this bottom area, try to hold it and not drop it. This bottom area of the model here, this is a large, thin, skeletal muscle. What is this muscle? This is the diaphragm. And the diaphragm is the divider between the thoracic body cavity and the abdominopelvic body cavity. So if it's above the diaphragm, talking about thoracic. If it's below the diaphragm, abdominopelvic. I will not ask you what body cavity the diaphragm is in. I won't ask you that.
You said
Sure.
the diaphragm is the divider of.
This is the divider of the thoracic body cavity and the abdominopelvic body cavity. And I'll flip back to that other
Abdominopelvic.
abdominopelvic, correct. And you can see on this figure here is the diaphragm. Right? This area here is the diaphragm, this dark black curve. And it's separating what they've colored in blue from what they've colored in green. Can you all see that? Yes. That's the separator. Above the diaphragm in blue is the thoracic body cavity. Below the diaphragm in green is the abdominopelvic body cavity. Now, if we look more closely at the organs in the thoracic body cavity, we could talk about the serous membranes that surround those organs. Serous membranes most people have heard of before when you hear of fluid around the lungs or fluid around the heart. Okay? We're talking about those serous membranes. A serous membrane is essentially two thin layers of epithelial tissue. Epithelial tissue is a covering or a lining. And fluid, serous fluid, in between those two thin layers of epithelial tissue. Kind of like two pieces of tissue paper. I'm going to put this here. It's like two pieces of tissue paper with fluid in the middle of that. Very thin. Okay? That two layers of tissue paper with the fluid in the middle, that is a serous membrane. And we do have this serous membrane around each of the lungs and around the heart. The serous membrane around the lungs is called the pleural cavity. Your pleural, immediately you'd be thinking of lungs. The serous membrane around the heart is the pericardial cavity. And again, I'm talking about two very thin layers of cells with a little fluid in between. There's often some confusion about these serous membranes. There is nothing but fluid in the pericardial cavity. There's nothing but fluid in the pleural cavity.
Can you move forward so we can actually see?
I sure can, yep. So there's only fluid inside of those serous membranes. I'll show you a picture, what I mean. Again, transverse section, right? Section through a cadaver this time. Here's the posterior, you know, because you can see the vertebra. Right here, you can see the spinal cord. We're focusing on the lung. The lung right here. You see that space all the way around the lung, it's black. That's a space. When the lungs expand, they push into this space. When they deflate, when you exhale, they move further away. This lung has a lining of a serous membrane. It has that pleural cavity lining. There's two layers of membrane, thin cells, and fluid in between those two layers. This this, what I've kind of colored in or bordered with the green and the red, that's the serous membrane. That's the pleural cavity. The lungs are not inside that pleural cavity. If the lungs were inside this cavity, they would be right here. Yes? Okay, good. This pleural cavity surrounds the lungs, but the lungs are not inside that cavity. It's surrounding it. Sometimes you'll see the analogy in the book, we might have a picture of this too, of a water balloon. And if you picture a water balloon, two thin layers of latex, let's say, and the water in the middle of that. And then you put your fist on the top of the balloon and try to push the balloon down. Your hand isn't in the balloon, but the balloon's around your hand. So this is how the serous membranes are arranged in the area of the lungs, and same with the heart. So we have another layer of serous membrane around the heart, and that's called the pericardial cavity. The term cavity isn't really used the same when talking about the serous membranes as is when talking about the thoracic body cavity and the abdominal pelvic body cavity. Yeah, Melissa?
What's the difference between the parietal pleural and
We're
the
gonna talk.
visceral?
I'm going to tell you that right now. Good. That's good. So notice how I colored these in, this red line and this kind of green colored line. Both of these are the borders of the serous membrane, but one of them is close to the organ, is actually wrapping around the organ, the lungs in this case. That's the red line. This green one is wrapping around or close to the cavity, the thoracic body cavity itself. The red one, since it's closest to the organ and basically touching the organ, we call this layer the visceral layer. Anytime you hear the term visceral, we're looking at an organ. Viscera or abdominal viscera means an abdominal organ. In this case, we're looking at the lungs, which is in the abdominal body cavity. Still considered viscera. So this is the visceral layer of the serous membrane. And because this serous membrane is wrapping around the lung, we say that this layer is the visceral pleura. Remember, pleura means lung. So it's the layer closest to the lung. Now the opposite, this green layer here, it's still around the lung, so we're still looking at pleura, but it's further away from the viscera. It's closest to the thoracic body cavity. So that layer we refer to as parietal. Parietal. The visceral layer, closer to the organ. The parietal layer is closer to the body cavity. What's in the middle of visceral and parietal? Serous fluid, which is basically water. So what's the point of it? Right? I have essentially like a water balloon around each of my lungs and a water balloon around my heart. Why? What's my lungs constantly doing? Constantly moving. They're constantly expanding and deflating, exhaling, inhaling and exhaling. Getting bigger, they're getting smaller. Constantly. Remember when we talked about muscle contraction last time? And I said muscle contraction builds up heat. Have you ever walked with socks on a rug and gotten shocks, electrical shocks? Right? It's building up friction. Anytime two surfaces are constantly rubbing against each other. And we don't want friction around our lungs and around our heart. We have enough, well, we hope we do have enough electrical activity going on within our heart on its own. Right? We don't want friction building up there. So it's kind of a lubrication around these areas that are moving a lot. So we have a little water balloon wrapped around each of our lungs and around our heart. It reduces that friction. You can see a little bit of the pericardial membrane or pericardial cavity wrapping around the heart here. And you can also see a piece of it at the very top. I'm too short to point to it, so I'm going to use the mouse right here. You guys see that? That black space? You know, this is really a hard structure to ask on a model, because I can't, I'm not going to blow up a water balloon and tape it to here. And so it's a hard structure to ask on the model, but when you do the dissection and you cut the rat or the pig open, try to look for the pleural cavity and the pericardial cavity, because you will clearly be able to see it there. If you don't cut through it first.
Yeah, and then the fluid will come out.
Then the fluid will come out and it will deflate and it will be very difficult. But it looks like a very thin piece of saran wrap. You all know saran wrap, right? Yes? Okay. And if you pull on it just right, you can actually see that it looks like a water balloon wrapped around the heart and the lungs. So be careful when you cut open. It's hard because you're going to be cutting through the sternum, and then below the sternum is going to be the heart. So you might nick it, but chances are between the 6 groups of you, hopefully, one of them will still be intact. And if not, I will do a dissection and show you. So you will be able to see it on the dissection. Especially when we get to the larger hearts, the pericardial sac will still be intact around the heart when you get the heart to dissect. So you will clearly be able to see it then. But I want you to see it. You have to wait. So pleural body cavity, pleural cavity here around the lungs. Lungs are not inside of it. Pericardial cavity around the heart. The heart's not inside of it. It is surrounded by it. If we look lower in the abdominopelvic body cavity, we could talk more about serous membranes, because there are serous membranes around many of your abdominal organs too. And we call those peritoneum. Another P. There's 3 P's, by the way, of the serous membranes. 3 P's. The pleura, the pericardium, and the peritoneum. Anytime you hear pleura, you think of, anytime you hear pericardial, cardio, always heart, and peritoneum means abdominal organs. So if I said the serous membrane around the intestines, then I would be talking about the peritoneum. It's going to be a hard one to see. The easier one is going to be the pericardial cavity. That'll be the easier one to see. And then the pleural cavity, where it meets the diaphragm, that will be probably the second easiest for you to see. Athena, you had a question? Yeah.
What happens to the part on this way later when you smoke cigarettes?
When you smoke cigarettes? Well, the whole point of the bad thing about smoking, one of the bad things, is that you're breathing in arsenic, tar, rat poison, plastic. If you go online, there's a list of 1,000 different substances that you're breathing in. Where those are going is actually into your lungs. Okay, and since they're going into your lungs, here's your trachea, which is this part right here, dividing into the bronchi, and they would be here inside your lungs. Not necessarily into the pleural membrane, but in the alveoli, in the air sacs of the lungs themselves. And essentially what you have is where you would have a nice, compare it to a balloon too, a nice balloon that's able to expand and contract. And the membrane of that balloon is very thin so that oxygen can be passed from the inside of that balloon into your red blood cells. And CO2 can be passed from your red blood cells into the balloon to get out of your body. You have a layer of tar covering the balloon. Rather than gases being able to easily move, it prevents them from moving. So you have a more difficult time breathing because of that. You're not able to easily move oxygen as you should into your red blood cells. It's kind of like suffocation. actually not only ingested water and our stomach, but also into their lungs. But yeah, oftentimes fluid will build up within the lung tissue, and we can drain that fluid. Syringe. What do you think is going to happen to the blood pressure of someone that has extra fluid around their lungs or heart? It's probably going to increase. It's now harder for you to breathe. It's going to hurt when you breathe. You might have pain in your back. When the doctor listens to your lungs, they put the stethoscope on the back, on your back. You all notice that, right? The doctor will listen to your heart up here in the front, but when they use the stethoscope in your back, they're listening to your lungs. And they're making sure that it's nice and clear and that they don't hear any rattling. So if they hear rattling, they're going to think, okay, well, there's fluid in the lungs. And it could be mucus built up in the lungs because you could have bronchitis or you could have a respiratory infection. And so they would hear that when they're listening to your lungs. They would hear like that. So what I've removed over here in this diagram is all of the organs in the thoracic body cavity, just so you can have a good idea of what the cavity is. It's this space, thoracic body cavity. And I've highlighted in this diagram in black the pleural cavity. So all this black outline, that's all the pleural cavity. In white, that's the pericardial cavity. You all see that? I've colored it in white. So two separate cavities. Structurally, they're pretty much the same. Functionally, really, they're pretty much the same. But two separate cavities. Diaphragms. Any questions so far?
So when you ask the question, what cavity is
Pericardial wouldn't be correct because remember there's no organs in the pericardial cavity. The heart is surrounded by pericardial cavity, but the heart's not in it. So, you know, I probably wouldn't even give that to you as a choice because I would think that's too tricky. I'm not here to trick you. The material's hard enough as it is. Okay. You know, so the choice might be thoracic body cavity, pelvic body cavity, vertebral body cavity, something like that. If mediastinum is there, then that would be the most correct answer. But if it's not, then I would pick thoracic body cavity. I would not put pericardial cavity there. I would think that that's tricky. But if I ask you true or false, the heart is located in the pericardial cavity, that would be a false. Because it's not. Questions? What body cavity is the spleen located in? Okay, and you can even be more specific now. Abdominal body cavity. What about the bladder, the urinary bladder? When I say bladder, you just automatically assume it's the urinary bladder. Because if I was talking about the gallbladder, I would say gallbladder. You said pelvic, right? Good. We've done this. So just like we had in this diagram over here, the visceral layer and the parietal layer, we had both of those layers of the serous membrane, and we talked about it around the lungs, the pleural, and the pericardial around the heart. The peritoneum, the third P we were referring to, the third type of serous membrane around the abdominal organs, they also have visceral layers and parietal layers. Visceral peritoneum would be the layer around the abdominal organ itself, and parietal peritoneum is the layer around the abdominal body cavity. Terms are the same. Visceral or parietal in any of the 3 Ps. Does that make sense? Yes.
So is it there to reduce friction as well?
Pretty much, yeah, because those areas are moving too. You've got segmentation going on and peristalsis going on where you're moving food throughout the GI tract. I thought I had another slide, another picture on here of the regions and the quadrants. So let me go back. Do you guys have a copy of it? Regions and quadrants picture? No. Okay. So you can find that in your textbook. Should look like this, and it is on page
So,
20. Thank you.
so the names are not part of any
Correct.
study?
Correct. Yes. Yep. We're just looking at organs. I'll make it a little bit bigger. A little bit better. Okay, so we were looking at the thoracic body cavity above the diaphragm and the abdominopelvic body cavity below the diaphragm. When we are looking at regions and quadrants, we are talking only about the abdominopelvic body cavity, not the thoracic. What's in the thoracic body cavity? Lungs, heart,
Esophagus.
parts of the esophagus, parts of the trachea, okay? Thymus, which is one of the other glands I pulled off my heart before. All of those structures, we're not talking about any of those anymore. We're looking only below the diaphragm. Here's the diaphragm here. Only below it. Okay, do not get confused if I say, what region is the heart in? That's kind of a trick question. That's a none of the above answer. It's not in a region. It's in the thoracic body cavity or the mediastinum. Okay? Always remember, regions and quadrants are below the diaphragm in the abdominopelvic body cavity, so we are not looking at anything in the thoracic. We can divide the body, the abdominopelvic body cavity, into 4 quadrants, just like math. Okay, when you had 4 quadrants in math and you were graphing, does that sound familiar?
Yes.
You had the y-axis and the x-axis, and you're not going to have to graph, so don't worry. Okay. But we had these 4 quadrants. We have an upper right quadrant and a lower right quadrant, an upper left quadrant and a lower left quadrant. If we use the abdominopelvic body cavity as our, let's say, square, we can play the game 4 corners. Anyone ever played that? You divide a box into 4 squares, 4 boxes, and you think about, okay, well, what's in that upper right quadrant? What's in that upper right square? Or what's in that lower right square? The key is, where are you going to put your squares? Where are you going to put your box? You have to have some way of centering that on the body. And the point at which the center is located is the umbilicus. What's the umbilicus? Belly button. I asked this last time too. Okay, so if the belly button, where we assume the belly button is located here, is the center of your box and your 4 corners, then what is located in the upper right quadrant? Notice I'm pointing here and not up here. In the upper right quadrant, and you can look at it on here and compare it to me, because a lot of students get confused with this, even in A&P 2, and they think, oh, that's the right. Because you're writing, and this is your right hand over here. That's not the right, that's the left. Always think of it as you're the doctor, you're doing the operation on somebody, and it's their body, not yours, that counts. So this is my right. This is the right side. this is the left side. If you have to draw, you know, a R over here and an L over here to remember that, then do that. Okay. The last thing we want is to go in for an appendectomy and the doctor to cut over here. Not going to be good. Well, that was my side of the body. Too bad for the patient. Okay? So upper right quadrant, the patient's upper right quadrant, gallbladder I heard, liver, portion of the liver is here in the upper right quadrant. Anything else?
Part of the intestines.
Part of the intestines, part of the small and part of the large intestines, both in the upper right quadrant. And you will see overlaps. The small intestine is in every quadrant. It's in every quadrant. Large intestine, in every quadrant. This region of the large intestine going across here at a transverse plane, this is called the transverse colon. So is the transverse colon in the left lower quadrant? Transverse colon is just this part right here. It's in the upper right and upper left quadrants. This region over here of the large intestine, okay, this is called the ascending colon. Is the ascending colon in the lower left quadrant? No. No. It's in the right lower quadrant and the right upper quadrant. How about the appendix? Right lower quadrant. Appendix is right here. It's like a little worm extending down from this area is called the cecum, the first part of the large intestine. So this little worm that's extending down here, that's the appendix. It's in the lower right quadrant. And if you've ever had pain, it's in that area. Remember, the belly button is always the middle. So you're looking above and below, not up here.
How high up does it go again?
This goes right up to the diaphragm. Stops here. You can probably, if you want to use your body as an example, you could probably feel where your ribs are located and where they end. The end of your ribs here. You move around from that. That's pretty much the very top of your abdominal body cavity. You feel your hips, your hip bones sticking out. That's these on either side. You can use that to help you to divide the upper from the lower quadrants. Your hips should be pretty much level, the transverse plane, with your belly button. So use that as the divider. Practice the quadrants on the torso models that are in front of you. And I know you can't see the belly button, but like I said, use the hips and the diagrams here to help you out. The small intestines, we're basically looking at, again, in every quadrant. And I will not ask you something that's in the border here. Okay, I'm not going to ask you anything that I think is close. But there are organs like the liver and the stomach and the transverse colon that can be in more than one quadrant. The majority of the liver, for example, is over here in the right upper quadrant, whereas the majority of the stomach is in the left upper quadrant. Keep in mind when I ask the question, if I say majority, then just give me the one quadrant that most of that organ is located in. Yeah.
Where's the pancreas? I know it's behind.
Yep, the pancreas is, so this is the stomach here. It's kind of shaped like a J. And the very end of the stomach, the pylorus, kind of curves like this into the small intestine. And the first part of that small intestine is called the duodenum. The head of the pancreas is right within that. So part of it's in that right upper quadrant, and the tail of it is pointing into the left upper quadrant. But you'd have to really remove the intestines in order to see that. You guys have the torso in front of you.
So if you asked like where it is, you would put right upper quadrant and left upper quadrant?
I would. I mean, those would be the selections that you can choose from.
Okay.
So here's the pancreas right here. Okay? It's pretty much right above that transverse colon. And it goes from this midpoint, past the midpoint, over towards the left-hand side. The pancreas tail, this part here, points towards the spleen. The spleen is actually still stuck in the model on the left-hand side, on the side of the stomach. I think it's easier to show you with the other model because you can see it here, maybe a little better. Okay, so this is the model that we have of the pancreas. This is all the pancreas. And this is the duodenum, this part here. So if I was to put this where it really should go on this figure, it would be right here, like that. This would be connected to the stomach, but now we're moving into the small intestines. Here's the head of the pancreas and the tail pointing towards the spleen. The spleen right here, you can see a little bit of it in purple. Can you guys see that? That's the spleen. So the tail of the pancreas is kind of pointing like this. On the rat dissection, the pancreas is going to be a little tricky to find, but I will help you with that. This one doesn't fall off. All right, so the quadrants, that make sense? Pretty good? Not bad? So now that you know quadrants, and we had looked at the belly button, the umbilicus as the center of those 4 quadrants, let's look at the regions. Again, regions and quadrants are only diaphragm down, abdominopelvic body cavity. In this case, the center region is the umbilical region. The umbilicus, the belly button, is in the center of this box. This box right here would be centered over this one. Okay? At the very top here, in the center, would be this box. This is the epigastric region. Epi, prefix epi, means above. And gastric, gastrointestinal tract, intestine, stomach, and all these digestive organs, is the top part of that gastrointestinal tract. So epigastric region is that top center part of the abdominopelvic body cavity. What organs are in the epigastric region? It's part of the stomach, part of the liver, part of the gallbladder, part of the pancreas, a lot of things, right? Okay, a lot of digestive organs in that epigastric region. The left hypochondriac region, a major organ that you definitely should know in that region is the spleen. The spleen is in the left hypochondriac region. Again, you can see a little piece of it here that's in purple. Also, a piece of the stomach is in the left hypochondriac region. How about the right hypochondriac region? Majority of that region is the liver. The majority of it is the liver. What's the umbilical region contain? Majority of what? What kind of intestines?
Small.
Small intestines. Majority of the small intestines. And the lumbar regions? Kidneys. Yeah, large intestine is there too, but kidneys are a good answer for that one. How about the hypogastric region? Hypo means below or under. We're not looking at, we're not looking at epi, we're looking below. So what's in the hypogastric region? The bladder, urinary bladder. Best answer for that one. But yes, there's also small intestine. There's also some of the large intestine as well. The sigmoid colon and the rectum is in that hypogastric region. This region right here. How about the right inguinal? The appendix. You can see the appendix right here in the right inguinal region.
Is it also right iliac?
There is another name, yes. There is another name for the inguinal region, and that is iliac. Iliac and inguinal are interchangeable. Good. questions on the region and the quadrants? How many quadrants are there?
4.
How many regions? 9. 9. It's just like tic-tac-toe. 1, 2, 3, 4, 5, 6, 7, 8, 9. Just like a tic-tac-toe board. So you can play tic-tac-toe and you can play 4 corners. All in the abdominal body cavity, but not in the thoracic. No fun up there. Yeah. Yes. Yep. You'll primarily see them right here at the corners of each of these regions. Yes.
What's the primary difference between the region and the
The quadrant is larger area. Region is more specific. So if we were to describe an area of pain, we might say I've got pain in the lower right quadrant. Or if we were going to describe an area where we're going to have surgery at an exact point, or somebody has an injury, a gunshot at an exact point, then we would use a region. Yeah.
Are we gonna need to know like the specifics of the intestines, like obviously transverse colons, like the rectum and the
Duodenum. You should. I believe they are on your list, and it will help you to know them. I'm not going to say is the duodenum in the what quadrant or what region, but to at least know what it is. It's part of the small intestine. It will help you.
But we don't need to know like the quadrant region.
No. For the regions and the quadrants, mostly what I've asked so far: liver, stomach, transverse colon, small intestines, appendix, things like that, spleen. Those are going to be the ones that I'm going to ask you. You'll see that as you go through the lab packet too, because I've put those on there.
Should we know all the names of the regions by heart also?
Yes, definitely. Yes. Yeah, if I gave you a tic-tac-toe board, you should be able to fill it in. Not that I'm going to do that, but, if I said superior to the umbilical region is the, okay, inferior to the left lumbar region is the, good. Medial to the right hypochondriac region is the, medial to the right epigastric. Good. Good. So I said medial to the right hypochondriac. Isn't that what I said? Yeah. Right hypochondriac. So medial to the right hypochondriac is the epigastric. Medial means towards the middle. Go into the middle. You should know the names of these and the locations of them. Yes. Yes. Same thing with these. And again, don't forget, it's the patient that's the most important. Right side, left side. Don't get confused with that. Transverse colon? Yeah, the transverse colon is right here. Okay, it's part of the large intestine. It's both in the right and left upper quadrants. And the transverse colon here is in all 3 of these top regions. Right hypochondriac, left hypochondriac, and epigastric region. Straight across the top. Sometimes if you look at a textbook or a drawing, this tic-tac-toe board might be a little bit higher or a little bit lower. Like the gallbladder in particular, if you were to look at the gallbladder, it might be over here or a little bit lower in a certain textbook. I'm not going to be so pinpoint of things, specifically the gallbladder. But the appendix really doesn't change. The location of the livers really, it doesn't change. We'll go by a figure that's in your textbook first, but I did give you a few other views, both in the lab handout and also on Blackboard, if you've printed any of the figures on Blackboard. So you can kind of compare them. With all of them, the middle should be the umbilical region. The middle should be the umbilical region. In the middle of that, the umbilicus. You should be able to look at the torso or look at a figure and implant this tic-tac-toe grid on top of it. Same thing here. That's your work for Tuesday. So when you do the right dissection on Tuesday, and I put a pin on one area, that you will know the region or the quadrant immediately, and the organ. garden, of course. Questions on anything from chapter 1? That's pretty much the end of chapter 1. Take a break, 15 minutes, come back. I've taken out a ton of models, so you have more than enough to practice with. And start to go through that lab pack.